Welcome back. Thanks for sticking with us here on the Consumer Quarterback Show. We always want to help you be a more informed consumer, help you as a consumer advocate here in Tampa Bay. And we do that by bringing on all types of great expert contributors. And we've got one of our favorite coming up here in just a moment, Linda Ward, President and CEO of Gulfside Healthcare Services on the program. And later on, we have our feel-good story of the day, which is pretty cool. If you watch TV, you might have seen this too. It was a Domino's employee who fell delivering pizzas. And now the family raised over $260,000. That's our feel-good story of the day coming up here. And before we do, we always like to feature our real estate listings. My wife Lindsay and I own a top-ranked real estate team, Keller Realty, and we're in the top 100. One of the strategies is where we help our sellers by featuring the listings live on air, our real estate listings live on air, maximizing the exposure and the profit. We got a hot listing on the beach at 16400 Gulf Boulevard. This is North Reddington, beautiful condo/co-op here on the beautiful beaches of Pinellas County, 16400 Gulf Boulevard, North Reddington, 400 square foot condo, priced at $299,000, just under $300,000. Great opportunity, beachfront, pool front. Your private balcony overlooks the beautiful pool and the dolphin-filled waters and sugar sand beaches of Pinellas County. And that's just one of our 50-plus listings at the Platinum MVP team at Keller Williams Realty. You can see all of our listings at platinummvpteam.kw.com.
Buy dirt, find one you can't live without.
And you can also buy dirt. We got a lot of vacant land available as well, about a dozen or so vacant land parcels ranging from 30 acres. We've got 100 acres coming up close to Disney World for development, waterfront land available as well. Lots of opportunities. So reach out. We'd love to talk to you. All right, Linda Ward, welcome back in. Good to have you.
Hi, Brandon. Nice to see you again.
Yes.
Thanks for having me.
Likewise, my pleasure, and we appreciate you coming in. And so there's some exciting projects in the work over at Gulfside. Tell us a little bit more about what's happening.
Sure. We have purchased 4 acres of land to build our second freestanding inpatient care center and are well on our way to design and breaking ground coming in June, July this year. And very excited about it. Our patients on the west side of Pasco County have been serviced in their homes or assisted livings or nursing homes or in hospitals, which is, not the best place to receive hospice care. It's really a transfer out. And so right now we've got a 6-bed unit, which has been serving us well, but it's time to really open up a new inpatient care center. So we're very excited about it.
Wow. So your current facility is only 6-bed? Is that what it was?
It is.
Wow.
And through the years, we've grown so much that we've been servicing patients at that inpatient level of care in hospitals.
Right.
And so the hospitals are very supportive of this because, of course, they would like to be able to free up their beds, transfer patients to a hospice care facility. We've got great partnerships with the hospitals, so they support the effort, and we're very excited about that.
Yeah, so it sounds like the new care center sounds like a pretty big undertaking. And Pasco County is growing so fast, so it seems like it was necessary for you guys to kind of grow to that end.
Yeah, it really is. We've got about 350 patients in West Pasco. We've got another 300 in East Pasco. We have a 14-bed care center in Zephyr Hills, but have been waiting for the timing just to be right to build this care center on the west. And based on our growth and based on the need, that'll be a 24-bed facility.
24-bed facility. Oh, that's awesome. And what's the timeline for the new care center?
So we're going to break ground probably June, at the latest July of this year. It'll be a 12-month construction from start to finish with a grand opening projected, year from, June, maybe June of 24 or so.
Awesome. Yeah. And so Gulfside Healthcare Services, if you are not aware, it's a nonprofit organization. So you're always looking to raise funds and get people involved, and there's volunteer opportunities. Can you tell us about that?
Sure. Lots of volunteer opportunities and many ways to give at Gulfside. Right now, with the care center, we've launched a capital campaign. So the building's probably going to cost around $12 million or so, and we're looking to raise about $2 to $3 million in our capital campaign. We opened up the silent phase of the campaign a few months ago and have raised about $100,000, and now we're going public so that we can really put it out there. So, there's lots of naming opportunities, such as the exterior fountains. Different areas within the care center itself, the flagpole, the stained glass in the chapel, patient rooms, physician rooms, doctor's offices, patient care areas, nursing stations. And so the community embraces the capital campaign. We raised about $3 million in our last campaign, so we're hoping that we have good success in this one.
Oh, that's awesome! $3 million raise. That's no small feat.
No, it takes a lot of effort, but Gulfside has been in Pasco County for over 30 years now, and the support is tremendous. There are 3 providers, and Gulfside alone has about 75% of the market share. So our families and healthcare providers and our referral sources continue to use our services because we really are considered the provider of choice.
Yeah, absolutely. That sounds like it. If you just joined us, we're talking with Linda Ward. She's the president and CEO of Gulfside Healthcare Services right here in Tampa Bay. We're talking about a recent purchase they made of some land, 4 acres, and they're looking to build out a new care center, potentially up to 24 beds or so, looking to raise some money here, and there's some opportunities. I think when you think about what you just mentioned, the naming opportunities, the thought of legacy comes to mind.
Yes.
Right. How does that play out in your mind when you think of a family that may have some extra dollars to donate, and the naming rights and the legacy of that family?
It's a beautiful thing. So I could tell you so many stories, but just a couple that comes to mind. We had a beautiful board member that just passed away, and her name is Marie Pacone. And before she passed away on our hospice care just a couple months ago, she wanted to name the stained glass in the chapel. She's a very religious woman, and so her name will be there next to the stained glass in the chapel. My father died on our hospice care in 2006, and he was very patriotic. He served in the Korean War, so I named the flagpole after my dad.
Oh.
And it's those kinds of stories that we have so many. We have a physician who serves on a board, and he was a capital campaign donor for the previous care center for the physician's office. He's doing the same thing for this physician's office for our new care center. And we have family members that have just experienced wonderful care and service at the care center, so it means a lot to them. If they can't actually contribute to the capital campaign, they would more than likely donate to the Wall of Caring or the Butterfly Garden or a bench out in the garden. So there's lots of levels of donations, and typically it's for someone who has really been affected by hospice and has been involved and seen the good that has been provided, much of which is not reimbursed.
Right. Yeah, and you do so much in the community to take care of people. How will this new facility, impact your overall mission?
So it impacts the mission because we are regulated by the Agency for Healthcare Administration and the Centers for Medicare and Medicaid to be able to offer 4 levels of care. The inpatient care center is at the highest level of care, which is called general inpatient. So that is for patients nearing the very end or that are transferring from the hospital with some kind of pain and symptom control, or come in from receiving care at home that are in a crisis that needs to be managed, and then they can go back home. And so because that demand has grown, and because hospitals really have grown themselves, and they
Right.
really want to be able to free up those beds, they partner with us to transfer patients out to the care center. So it's going to serve patients at the end of life to meet our regulatory requirements, to meet the demand of the community, and to really help people that cannot remain at home.
Right. And if you've heard our show before, we've had Gulfside Healthcare Services, all the great, a lot of different team members on the show. We've had chaplains, the thrift shops, and just all the great team. You've got an awesome team over there. But would you mind giving us a quick overview, too, of the 3 main pillars or types of services that you offer there, Linda?
Sure, yes. So hospice care is one of the 3 service areas for Gulfside, and that is for patients who are 6 months or less prognosis, terminally ill, and doesn't mean that they're only going to be on the service for 6 months. Many patients stay on for years, as long as they meet the qualifications and have some type of diagnosis that meets hospice care. And that is provided through an interdisciplinary team. Much of what you referred to are physicians, social workers, chaplains, nurses, certified nurses' aides, volunteers. And that service is provided to the patient wherever he or she lives: home, retirement community, nursing home, assisted living, our care center, etc. So that's that was how Gulfside got started, and we have over 600 hospice patients. And then in 2009, we incorporated Pasco Palliative Care, which is non-terminal palliative care for more like chronically ill patients. And we started out by contracting in hospitals, providing palliative consults to inpatient hospital patients with the Bay Care system, and that has grown to all the hospitals, and now we have our own clinics for palliative care. So it's for chronic disease to help with pain and symptom control. And we have about 250 palliative care patients. And our most recent diversification was with skilled home health and rehab, and that's Gulfside Home Health. We serve over 100 patients currently in Pasco and Pinellas for skilled home health care in the home, post-hospitalization rehab, physical therapy, occupational therapy, speech therapy, nursing care, education, and beyond.
That's awesome. And the website, Gulfside.org, Gulfside Healthcare Services, Gulfside.org. Also, Gulfside on Facebook, that is, Facebook.com, Gulfside Healthcare Services on Facebook. And final thoughts, back to you.
Final thoughts are, if you yourself is experiencing any kind of physical ailment and might need some help in your home, give us a call, look us up. If you are a caregiver and you're caring for someone with a chronic illness or an acute illness and you're needing some assistance, just give us a call. We'll come out and evaluate and help you and see if we can provide some care for you.
Excellent. Yeah, and you can call directly on their 800 number. It's 800-561-4883. That's 800-561-4883. Gulfside Healthcare Services, Gulfside.org. Linda Ward, thank you so much. Appreciate it.
Thank you, Brandon.
Always a pleasure having you.
You too.
All right, we're going to take a quick break. We're going to come back. Jenny Restrepo, Insured Title Agency. We're going to talk about some of the different happenings in title. We've also, in the past, covered some of the true crime scenarios playing out in real estate and real estate fraud, wire fraud, and more with Jenny Restrepo here on the Consumer Quarterback Show. Plus, our feel-good story of the day. Find out about this family that raises over $260,000 for Domino's employee who fell delivering pizzas. We'll be right back. Consumer Quarterback Show, ConsumerQB.com.
Hey, everybody, it's the Captain, Matt Bruce, and you're listening to my buddy, Brandon Rhymes, a Consumer Quarterback. Sell, Brandon, sell.